over time with nicotine use, you're feeling like you're getting an ADHD boost, like it's improving those symptoms. But what's really happening is that over time, it's actually making those fewer dopamine receptors that you have less able to recharge with dopamine over time. That's crazy. Because one of the other things that we've mentioned before in terms of the dopamine baseline, so you talk about the spike that nicotine and caffeine and alcohol that these can have. What happens is if you give like a child like a really sugary drink, that they'll have like this big spike, but then after that big spike, there comes a massive crash, and that goes lower than where you were in the first place. And whilst we think that we're getting an improved sense of how we feel, like we're actually, again, reducing our dopamine baseline, which is effectively where we're at a disadvantage as already. So it's mad how the brain can trick us into thinking, no, this is what we need. This is what we need.
And that is both the implications of addiction in general. So in people without ADHD, like myself, addiction in general will trick you into thinking that's what you need. It produces those cravings, those you get impulsive in a way, and that you have to go out and buy one, even though you know it's going to cause you harm, and the withdrawal symptoms. So I would add one further thing to what you just said, Lawrence. So your dopamine receptors are already low. Over time, chronic use, your symptoms are likely to get worse because of dopamine receptor blunting. Secondly, you're more susceptible to withdrawal symptoms because of the baseline levels of dopamine. And thirdly, for those people with ADHD on medication, it has an implication. The implication being is that nicotine basically affects the way that ADHD medications work.